Health for All Coalition is a civil society health advocacy network on health and health-related issues in the country. The coalition was established in April 2008 through nationwide consultations with civil society groups and officially launched by the First Lady Sianya Makruma at the Princess Christian Maternity Hospital, Fruby Road in Freetown. Since the organization was formed, it has been advocating for the equal distribution of health care delivery for all Sierra Leoneans countrywide. The coalition is working with partners including the government of Sierra Leone through the Ministry of Health and Sanitation, local and international groups and institutions to ensure the provision of proper health facilities to all rural and urban communities in the country.
Health for All Coalition came into being as a result of a national conference organized by the main body, Coalition of Civil Society and Human Rights Activists, which was called to actually evaluate the interventions of civil society organizations in Sierra Leone. Among the things that we identified as having not done much was that of health, sustained and consistent health advocacy. With the advent of Health for All Coalition in 2008, we were able, in collaboration with some of our partners, to launch a massive campaign which we call Abolition of User Fee campaign. This campaign was primarily targeting the government of Sierra Leone and developing partners on account of the fact that user fee was recorded as one of the greatest barriers to accessing health service delivery, especially by women, children, and the other vulnerable groups.
Health for All Coalition aim is to advocate for the accessible, affordable, and available quality health care for all Sierra Leoneans. The coalition is committed to supporting the government of Sierra Leone and its partners in the implementation of the free healthcare initiative in the country. To achieve that, the coalition has a network of 150 civil society groups to monitor the free healthcare initiative at chiefdoms and district level countrywide.
Thank God with the commitment of His Excellency the President, Dr. Ernest Bai Koroma, and donor partners, he was able to assure us and commit himself to the introduction of the free healthcare, where in a meeting he personally promised us that in November 2009, he is going to make a declaration for the introduction of the free healthcare. We played a very important role in making sure that we have the policy in place, we have the paper signed, and we have other things in place. We should not also sit by and look at things after all of these commitments have been made. We should also sit by and look at things go the wrong way. We should also make sure that whatever is being committed in that policy, whatever it is in that policy, reach the beneficiaries. So as a civil society group, our motive is to make sure that we communicate the issue of this free healthcare policy to the people. We popularize it. That was our first intervention. The next thing we do was to see how best we can monitor the process. We also want to make sure that the policy is not only a white paper policy, but it is a policy that is fully implemented by the government of Sierra Leone.
The coalition is arguably the first non-governmental organization that has worked effortlessly to the successful implementation of the free healthcare initiative by the government of Sierra Leone. Before the initiative implementation, the coalition was in the forefront to advocate for the abolition of user fees in government hospitals and peripheral health units across the country. According to the coalition, the abolition of user fees in hospitals and PHUs will reduce the country's high infant and maternal mortality, as it is one of the highest in the world.
We have instituted a policy of monitoring and community education across the country. We have offices in all the 14 administrative districts of the country, with district coordinators trained and empowered with means of transport and stipend from our development partners. Training conducted by the Ministry of Health and Sanitation, Monitoring and Evaluation Department, and other partners, including DFID Option, UNFPA, UNICEF, to name but a few.
After the launching of the free healthcare initiative by President Ernest Bai Koroma in April last year, Health for All Coalition has put in place structures to ensure effective and efficient distribution of drugs, logistics, and supplies meant for the Free Healthcare Initiative. They have trained over 400 health monitors, which operates in all 14 districts and 149 chiefdoms in the country, including 52 wards in the western area, with 14 district coordinators, 4 regional supervisors, and 4 monitoring and evaluation officers. The coalition says they put such measures to make sure that beneficiaries, including pregnant women, lactating mothers under 5 children, get the service.
We've been able to mobilize the community interest into monitoring the free healthcare services in their locality. More than 400 community monitors had been trained in their own localities and provided with means of transportation to see that social accountability is also being maintained in the provision of the service for the target people.
To ensure the effective and efficient distribution of drugs, logistics, and supplies meant for the Free Healthcare Initiative, the coalition set up a drug distribution and supervising unit charged with the responsibility of monitoring and supervising the free healthcare drug distribution, utilization, and supplies across the 14 district stores, including the Central America stores here in Freetown. Hence, 40 drug supervisors were recruited and trained to monitor the distribution of drugs and consumables from the Central Medical stores, district stores, and various PHUs across the country. Each of these trucks with the free healthcare drugs were accompanied by the coalition monitors to ensure the safety of the drugs onto its destinations.
Health for All Coalition trained 40 drug supervisors with mandate to monitor drugs from the airport or seaports to the Central Medical store and to all peripheral health units across the country. We have monitors that actually moves with the drug vehicles, some of them at their own risks. We have had more than 2 accidents where our drug supervisors and monitors were involved. However, we were able to rescue both the drugs and the lives of our team and those on board. And we have actually been providing our services as per our term of reference, our monitoring tools developed by our partners, Ministry of Health and Sanitation, UNICEF, UNFPA, and many others. And we are very, very much thankful to all our partners for supporting us to ensure that the target beneficiaries receive the services of the free healthcare.
There are lots of things that we do as part of the health development partners. We provide technical assistance, particularly to the Ministry of Health. And in this slide, we have provided the direct health services to mothers and neonates. Neonates are the 1 day to 1 month, because once those babies become 1 month, they are UNICEF's support. They have to be immunized and all. So we do provide that. And we also build capacity of different health cadres. We are supporting the nurse anesthetist training, midwife, lab technicians, and other medical cadres. And I think that other colleagues, other agencies that are to support them should give them the full support so that they will really achieve their focus and main objectives. But we still have challenges. A lot of these women do not go, and we still hear of the fact that some health providers are demanding. The Health for All Coalition may need to strengthen its operation, may need to get more people to work. They are doing their best, but with only if it's only UNFPA that will support them, then they will not be able to make the difference that they want to make. So other health partners should assist them because they're credible civil society organization. They're fair. They don't they speak the facts which they see on the ground. And I think we will we're doffing our caps to them and to endorse that they can be trusted as a partner.
Trips like these by the Coalition Health Monitors is to make sure drugs, logistics, and consumables reach its intended targets. So these health monitors have to pay regular visits